with our topic, Fill Up Your Tank Doctor's Orders. And today I would like to introduce Dr. Michelle Foster. She's a doctor of acupuncture and Chinese medicine. She's on the national and state licensing of acupuncture. She's a registered nurse and a massage therapist. Michelle has 15 years of experience as a licensed acupuncturist, and her specialties include pain, weight loss management, and mental health. She incorporates her skills as a registered nurse, a massage therapist, and level 2 healing touch practitioner as included in her acupuncture practice. So Dr. Michelle has helped develop the inpatient and outpatient acupuncture programs in the Cushman Wellness Center and the Sharp Memorial Campus. Her mission is to educate, empower, and inspire others to co-create a preventive healthcare plan. And I think I forgot to mention, my name is Sharon Murnane, so please contact us at any time in the Cushman Wellness Center. And now I will turn this over to Dr. Michelle Foster.
Thank you, Sharon. That was a very nice introduction. Welcome, everybody, to Fill Up Your Tank Doctor's Orders. This is what I'm telling my patients pretty much every day, to fill up your tank. And when I say fill up your tank, I'm really referring to preventative health medicine, something we're not really taught in the Western model framework. So Eastern medicine can play a wonderful role in filling up your tank and adding in many, many different tools and modalities, which I'm going to be going over today, that can help you with whatever health condition you're going through. So as Sharon said, I've been a long-time employee at Sharp. I helped to assist in developing acupuncture services for outpatient and inpatient way back in 2008. So a lot has changed over the years. I've worked at Sharp for a total of 18 years, and I was also born here. So kind of doing the full circle. And both as a registered nurse, psychiatric nurse, and doctor of acupuncture Chinese medicine. And then, as Sharon said, I can also be available for massage therapy, healing touch services. And we just launched our EarSeed program actually a couple weeks ago. Things are going great. We'll have information on that, and we'll also be doing a live model for EarSeed placement. So stay tuned for that. That's coming towards the end. And this, again, ear seeds are wonderful for whatever ails you, pain, insomnia, immunity, you name it, we can treat it because the ear represents the map of the body. I also have my EarSeed certified practitioner. It took me 13 weeks to get that. I utilized my COVID pandemic time very well. And I got EarSeed certified as a practitioner for that. So health is all about balance and creating homeostasis. So I'm just kind of a mediator to getting you there. And all the different things that we do can create homeostasis, a balance within the body. All right. Next slide, please. So now we're on to a brief history of traditional Chinese medicine. Chinese medicine has been around thousands of years. Some say 3,000, some say 5,000. And it consists of acupuncture, Chinese herbal medicine, massage therapy. We have certain kind of style that we're taught. It's called Tue Na, which is more like a rolling and kneading style. Qigong and Tai Chi exercises, which are great movement meditation exercises, which we can prescribe particular movements for your medical condition, just like yoga. So, and I also do prescribe yoga posturing, depending on what the patient's going through, such as anxiety, low back pain, etc. So there are many modalities that we can provide in our treatment. Like I said, I never run out of tools for patients. I like to start simple when I'm treating my patients, and that way we always have something else we can add in to the repertoire, change it up, design a health plan especially for you. So on to, what does holistic mean? You've probably all heard of holistic, and it means we're all encompassing. We look at body, mind, and spirit. which is going to create the balance within the body, mind, and spirit. So Chinese medicine, kind of different from Western medicine. We look at the body as a collection to all together, not individual parts, and treat the body as such, and the mind and spirit. So whenever somebody comes in, whether it's like for pain, I am always treating the mental health component of that patient, because a lot of times pain comes from tension in our brain, which can create then musculoskeletal tension. So if we've got a relaxed, calm brain and mind and spirit, then our body gets relaxed. So it's all encompassing, which is really neat. What is qi? You've probably all heard of qi, and I'm going to break it down into various definitions for you. One English translation of the word qi means energy. It's also known as the life force. And since the total absence of qi is death, one's good health depends on a balanced distribution of qi throughout the meridian pathway network. What is qi, and what does qi do? It's a subtle energy, and some people can actually feel their qi moving through their body. If you're really in tune to energy work and your energetics of your body, some people are very on it. Some people may not really notice. They just might notice, wow, I felt really good yesterday after that treatment or whatever. So qi is a vital force present in all living things. If we don't have it, then we're not in a good place, because we're probably dead. Pain, dysfunction, ill health result when there's a disruption in the flow of qi. So acupuncture stimulates certain points along the meridian pathways, which help to restore the normal balance of and flow of qi. I like to also break it down for the Western medicine folks and patients. Qi equals oxygen. It's an easy way to think of it. We're stimulating blood flow and oxygen flow, aka qi, when we're treating patients. Usually pain in the body is a blockage of qi. So we want to get that movement going, get the oxygen flow moving and the blood flow moving, which will help aid in healing the body. So there's different properties of qi, the movement for change and momentum. Activation is one of them, growth and development for all metabolic functioning. It also helps to warm the body, one that I need a lot because my nickname's Popsicle Fingers for medical school. So I'm always needing to warm my body and move my qi. Preventing external pathogenic factors. This is a huge one with COVID now. We want to protect our external, our wei qi, and prevent external pathogenic factors from coming in. So it helps to prevent disease and infection. Fourth one is transformation and transportation. This is great for food and nourishment of the body. We need to have qi to move this and help to break down our foods and move those energy particles throughout our body into something that we can utilize. And then a fifth one is containment. So qi helps to prevent the loss of blood, bruising, or of other fluids such as excessive sweating. If you have excessive sweating, we call that qi deficiency as a Chinese medicine diagnosis. And in Chinese medicine, we diagnose differently than Western medicine diagnosing. So such as if somebody comes in for pain of the leg, we would call that a qi and blood stagnation. So of that area. So life force energy is an energy field created by all living things. I love this visual picture. We're all energy balls. And, we can all kind of feel one another's energy when we're up and close. And even if you do this kind of exercise where you take your two hands, like the picture, and bring them together, I'm very energetic. So I'm feeling my qi right away. Even though I didn't get a lot of sleep, it's still there. I'm still alive. So it surrounds us and penetrates us and binds the galaxy together.